everyone. Hi everyone. Hope everyone is doing good. Everyone is doing great. This is Benny and let's start from where I left. Please refer my earlier video having the title Short Description of Visit to Cancer OR. This is in continuation from where I left. A chemoport is a small device placed under the skin that is attached to a vein in the chest to deliver chemotherapy drugs to the patient's body. I am going to give you a very brief description about chemoport. Without a chemoport, a new IV needle will be placed each and every time a patient has chemotherapy session. I assume some chemotherapy medications can only be given through a port as it minimizes the risk of infection. My wife told me that chemotherapy can also cause veins to be changed. Isn't it interesting? How can chemotherapy can change the veins, making them harder at times and more difficult to work with the traditional IV needle? That's all about chemoport. Let's resume my wait at the operation theater. Let's start with the waiting period. I was waiting at the surgical waiting hall. There was a guard whose job was to make entries in a thick brown colored register about patients' attendance along with their contact numbers. All of us hate waiting, even me too. I was standing near the window, waiting and watching outside scenes. Through the windows, I could see patients with their family members keep on coming and going. Here, the feeling of stress and anxiety was very much there. Uncertainty and fear were part of the scene. The wait seems to be very unbearable. I was anxiously waiting near the door of the OT in the hope of seeing our surgeon's face whenever the main door opens. The wait was a mixed one, as the life in the OT is very uncertain. My heart sinks at the very thought of waiting at the OT, as the attendant may be rewarded by hearing the news that a life has been saved, or sometimes a less unfortunate attendant may hear a loss of dear ones. The guard told me to go downstairs and wait at the main waiting lounge near the cancer OPD. While I was sitting on a sofa, I was waiting for the most important call. I was anxiously waiting for the much needed, anticipated news. My wife was already taken inside the operating theater, and I was staring at the huge wall clock. The time was crawling, and I felt as if the clock hand seems to be stuck in a place. Since I was all alone, I found the wait to be intolerable. All the negative thoughts started to creep in my mind, especially if a serial medical complications arises. What to do next? Where to go? Whom to ask? What has to be done? I hastily went to the operation theater and waited anxiously for our surgeon. I started talking to the guard in a low voice, even though I could see the signboard of keep silence. He understood my feelings of uncertainty and told me to pray to God. I could not gain enough courage that I have lost faith in God since 1983, the time my mother died, RIP. I became an atheist since then. I just looked at him and without saying anything, I simply left from there. This time I never went to the waiting lounge. Rather, I sat near the ramp next to the emergency exit. Though it was sunny and humid afternoon, I was feeling cold. The guard told me to keep my mobile handy. I was waiting for the call. The impact of the single phone call was truly much appreciated at that very time. While waiting for the news from the OT, I was wondering how can I take care of myself and manage my anxiety or stress I was feeling. It's normal to experience a range of emotions during this time. I was finding it difficult to manage my emotions. I thought of taking a quick short break. I stepped out of the building for some fresh air to clear my mind. I kept hydrated myself, and all the time I tried to stay positive and think positive. I simply tried to focus on my positive thoughts, and I was hoping a successful outcome. I was wondering about the pain my wife has to have at different periods. I was wondering how she's going to cope up, how she's going to overcome these feelings, how she is going to go further. Even though our surgeon has explained at length the different steps of the entire operations, such as the role of anesthesia, how long will it take to wear off its effect, the waiting period, the wait at the post surgery observation room, post operative period after being discharged, pain management, and other precautions we have to keep in mind once she gets discharged from the hospital. While these thoughts were running into my mind, I suddenly jumped the moment my phone rang. I could see the landline number of the hospital in my mobile's display. Without answering, I just dashed towards the operating theater. I just simply ran frantically towards the operation theater. I felt as if there is no one, there's an empty path, there's a single path. I can simply dash. That's all for this time. I shall continue in my further videos. Thanks everyone for watching my videos, and please do subscribe my channel Benny KR 1947. BENNYKR 1947. Thank you everyone. See you next time. Bye bye.